just got out of clinic, and I thought I would give kind of a reminder and a little bit of context of what I do a little bit more. I know I've mentioned, obviously, I'm in the medical field, but that's kind of a wide range. I assist a physician that is in a specialty, and he treats trauma cases, chronic diseases. He's a surgeon. It's a clinic setting, but we also do emergencies, and we take emergencies, and we see anywhere from 50 to 80 to 90 patients a day. We travel, like I've mentioned. We see all ages, but the majority is around 60 to 100, if I'm being honest. So, with that, something that I do love about it that I never really would have thought about in the beginning, and I remember when I shadowed the doctor that I assist now, when I first met him, shadowed him for morning clinic, he told me, he was like, well, you're gonna get to build these relationships with patients in a way that you wouldn't normally have been able to, because you're kind of going through life with them. We see them sometimes multiple times a month, and there's something that's really special and rewarding and fulfilling in the fact that, these patients, they're coming in, they're stressed, they're concerned, and being able to build that relationship where you have that familiarity with them. And I remember when I first started, we see so many patients, I remember hearing other people talk about or mention a patient, I can't believe this has happened, or how long we've been seeing them, and they'd name them right off the top of their head, and I'm like, how in the world do they do that? We travel, we go to so many different locations, and they just know them so well. And I understand now. I've been doing this for over 2 years, and I'll call a patient back and they're like, oh, Anna, hey, how's it been, blah, blah, blah. And being able to just kind of be that comfort for them in times where they are really stressed. And it's just nice. I was telling my mom actually the other day, my granddad, who I was really close to, he passed away right before I started this job. And obviously it doesn't replace any kind of relationship that I've had, but there's some patients that, will remind me of him. Or, my grandma, she is still with us, but she's not doing the best. And there's some, patients we have that remind me of her. And I don't know. There's just something really special about it. And like I've mentioned, the fact that we deal with chronic diseases, for me, is really special and near and dear to my heart. I have a chronic disease. I have an autoimmune disease. I have chronic fatigue, chronic pain. I'm on infusions, I'm on treatment every so often, I'm on oral medications, I'm constantly going to doctor's appointments. So in a way, I've been in my patient's shoes, and in a way, although it may be different situations, and I've seen it through them, but I know from personal experience how important it is to kind of have that person for you. And also, like I've mentioned, my mom has autoimmune diseases as well. She has a couple. It's very common with autoimmune diseases that you never have just one, you have a couple. And so just love that I can help in any way with that. But I just thought I'd give a little more context. Yeah. But again, the same way and kind of connection I feel to patients is kind of what I'm wanting to do with this. Is, like I've mentioned, whether you're, a person in their 20s, I'm in my mid-20s, you're trying to figure out life and balance and career, and, it's a very transitional time. But also, really, at any age, we're all kind of in different transitional phases, Whether you're, you're graduating high school, you're graduating college, you're getting married, you're, having a child, or you're moving, or you're having a grandkid for the first time. Like, whatever it may be, if you really think about it, they're all kind of transitional phases, and no one has it figured out. And if they act like they do, that's a red flag. They are lying. But yeah, my hope in making these videos is just genuinely to kind of make a connection with people, to make you feel less alone. And yeah, heading home. I hope you have had a good day whenever you're watching this. Good day, good night. And just a reminder, whether you're sick, you're chronically sick, you're not, but especially to people that are sick in any kind of way, it doesn't have to be an autoimmune disease, whatever it may be. You are loved, you have value, you have a purpose. You might be bedridden, you might be disabled, you might not be able to work. Whatever your situation is, you still have value, you still have purpose, and you're loved. It's a very heavy weight to carry, but you are seen. But yeah, I am going to head home. I'm heading home. Okay. Catch you in the next one. Hey guys, so this last week I didn't end up filming Thursday or Friday because I was just so exhausted. My physician was on call pretty much all week, and it was just brutal. I'm going to be honest with you, it was brutal. It wasn't even him being on call, it was already a heavy patient week in general, and it kicked my butt. I'm going to be honest with you, but I made it. It was one of those days where I remember by like Thursday, I thought back to where we had traveled that Monday, or this past Monday, and see, I'm already like out of it. I was thinking about where we traveled Monday, and I was like, oh my gosh, that felt like it was so long ago. And this will give a little perspective. In 1 week, we as a team have seen 300 patients. If that doesn't tell you how long the days have been and how exhausted I am, I don't know what will. Again, mind you, of course, I did not see all of them myself. It was my team. But what a week. But I'm gonna get some rest. Try to recoup. But thank you for following along. Oh my gosh. flew and hit my windshield. I'm not even following close to anything. I'm 3 cars away from this truck, and something just flew off and shattered my windshield. If that's not a great end to such a long week. Okay, well, let me rephrase that. I'm gonna get some rest, and now I've got to get my windshield fixed. Okay, it's fine. Alright, well, I think that's enough for this week. Thank you for watching. It's been a pleasure. I hope you will continue to follow along. And just know, I'm still trying to reel it in. I can't believe that just happened. But just know, regardless of your situation, or if you're sick, if you're not sick, if you're dealing with a chronic disease, whatever it may be, or maybe you're hustling in your career and you're exhausted, you're trying to find balance, whatever it may be, just know you're known, you're seen, you're loved, you have value regardless of maybe how limited you feel or how stuck you feel.